Hello, and welcome to Med Nation, our podcast where we explore different topics related to health and medicine. Med Nation is usually hosted by Dr. Lanier and Dr. Farnan, but I am excited to announce that I will be taking over this week's episode. I'm Han Yi, and this episode we have Dr. Sadia Dar, who is a family medicine doctor and an expert in weight management. In this episode, we will talk about topics related to weight management, including the medication classification of obesity, the different types of weight management programs, and the role of healthy eating, mindful eating, and exercise in weight management. Dr. Dar, before we start our conversation, please tell us about yourself.
Hi, thank you. Hi. I'm a family medicine doctor. I work with America's Family Doctors. I've been practicing family medicine for over 16 years now. I love and enjoy seeing my patients. And you're right, actually, weight problems is such a big and common struggle for most of our patients. So thank you for having me.
Yeah, of course. Thanks for joining us. So without further ado, I'm going to go ahead and ask you my first burning questions. So as we all know, we hear the word obesity on the internet or day-to-day life a lot, especially on the media. We hear about obesity rate, and even, when I was at school doing my healthcare management program, one of our projects was to look at obesity rate in Tennessee and do a study on that, just to see how we can improve the overall health of our community. So it is a very important condition. So do you consider obesity as a medical condition?
Yeah, I'm glad you asked. Obesity is a medical condition. Unfortunately, it's a modern condition. We didn't even know about obesity for almost up until a century ago, and today 40% of Americans are obese, and almost 70% are overweight. And this all happened in the last 60, 70 years. And we know why it happened, simply because we eat more, we move less, and we move less. Our body just goes into fat storage mode when we are eating more, and moving less.
Yeah, it's also, so that's why we call it a modern disease, because it's our modern lifestyle basically created this new condition. Yeah, so tell us about how the medical professions, the doctor sees obesity versus the insurance company and the business side of obesity, because I don't think everyone is aware of that.
Yeah, you're right. It's actually sometimes quite frustrating that we know and we see the patients who are obese, and many of their problems stem from being overweight. But unfortunately, not all insurance companies will cover the cost of prescriptions or even the labs and other testing if obesity is the only condition the patient has. So I hope this will change soon, because it will be tremendously helpful for our patients.
Basically, the medical world will see obesity as a medical condition, but when it comes to business, insurance companies, they probably won't see obesity as a medical condition in their eyes.
That's correct. Yeah.
Yeah.
For medical community, for doctors, nurses, and our providers, obesity is the number one cause. It's the root cause of so many other problems.
I feel like working in medicine is working with insurance companies, not really working in patients' favor nowadays.
Right.
Yeah. Thank you for the explanation. Just to clarify the condition, and a lot of people, when they struggle with their weight, I think nowadays weight loss programs or weight loss management or weight management is it's a huge thing now. Everyone is talking about it. So tell us about the different types of weight loss programs or weight management programs out there.
So it depends how much weight you're trying to lose. If you are trying to lose just a little bit of weight, and so you can fit in your clothes and feel good, most people can do that with making lifestyle changes. But if you are trying to lose more than 5 to 10% of your body weight, then I recommend that you see a professional a doctor, a nurse practitioner, your health coach, your primary care doctor, so they can guide you in regards to nutrition. And thankfully, now we also have some prescription medicines, which are very effective. For example, Ozempic, Mounjaro, Wegovy, and those injections these are powerful drugs. They really
Powerful drugs.
Yeah, in a good way.
Yeah.
They do help patients lose weight.
Most of the weight loss programs that I have seen, they have combination of using the medication, injections, and then they also kind of try to help patients to adapt to a healthier lifestyle. Do they have to rely on the injection for the rest of their lives to maintain the weight, or is that something that's, if they're off the injection, they will gain the weight back?
Very, very good question. So the simple answer to the question is that yes, when they'll lose weight when they're taking the medicine. When they stop the medicine, they'll gain the weight back. But there are things you can do, and that's why patients have to see a professional so you can work together. So what happens with these medicines, is that these are called GLP-1 analogs, and they help with gastric motility. So they basically affect your stomach, and you feel more full for a longer period of time. So you don't feel as hungry. And then through a different path, these medicines also suppress your appetite and regulate your insulin and glucagon hormones. As a result, you lose weight. If your weight loss is now consistent, you've reached the goal, and you have stayed in that range for a period of time, then your body will start becoming more used to the new weight. And as your body becomes more familiar with your new weight, now that becomes your weight. And then you stick with the lifestyle changes, and then you gradually wean yourself off of the medicine while sticking to the lifestyle changes. Then it's very easy for people to maintain the weight. But if you don't make any lifestyle changes, if you go back to the eating habits that you were before you lost weight, then it's almost
Definitely gonna gain.
almost guaranteed that you'll gain all the weight back.
So it's really important for people to know you are not just doing a weight loss program to get a prescription, to get like a medication. You are doing the program to hopefully to have a long-term lifestyle change and change your behavior going into this. I think a lot of people watching like TikTok videos or like media saying, oh yeah, like this medication is effective, then they think, oh, I can just rely on this and not to do anything else. But in your opinion, it's also important to eat healthy and exercise. Is there any side effects?
So the injection makes you less hungry.
Yeah.
So that is a side effect which you use in your favor.
Yeah.
And because it is affecting the movement of your stomach, your gastric emptying, we call it. Some people feel GI side effects, so they feel nauseous. They have bloating. Sometimes they have constipation, or they can have diarrhea. So there are some side effects, but fortunately, the side effects are not too strong, and most people kind of start to tolerate the side effects, and after a few weeks, the side effects go away. Or sometimes we have to adjust the dose of the medicine to alleviate the side effects.
Yeah, so that's why they probably should see a provider for it, so they can communicate those.
Yes, because it's not the same dose for everybody.
Oh, yeah.
So these medicines are, I would say, kind of comparable to the weight loss surgery. Like, some people get gastric bypass surgery or the gastric sleeve surgery, and it's a similar concept, except that it's a medicine and it's reversible.
So you don't have to do surgery. You don't have to go through surgery. It's probably cheaper than doing surgery, right?
Yeah.
A lot cheaper.
Yes.
Yeah.
Surgery is thousands of dollars.
Yeah.
And plus it's reversible, and it's more gradual.
Yeah, I cannot imagine not eating. Like I feel like I want to eat all the time, just snack on things. And when I'm bored or when I'm working on a project, I feel like I need to have some snacks with me. But in reality, I'm not even hungry. But I
Yes,
just want to snack. So
you're right. Many
Yeah.
people eat because they are just out of habit.
yeah,
They'll eat, or they'll eat because of the cravings,
yeah,
and they're not always hungry.
Yeah.
Hunger, biologically, we should only be hungry like once or twice a day,
really.
if that.
What?
Because hunger is associated with the circadian clock in our stomach and in our brain. So that's why if you like, some people are used to eating breakfast, and every morning they wake up, they're hungry because that's the time they've set
To eat breakfast,
to eat
so your
breakfast.
brain is so every morning I wake up, feel like my stomach is yelling at me
Yes.
for food.
Yes.
But but towards the dinner time, sometimes I don't get as hungry.
So that's your circadian clock.
Oh, so everyone's is
then
different.
For some people, morning is not the time to eat, and they feel hungry in the middle of the day. So which is okay. So you just go by your circadian clock, which is totally fine. But then don't eat in between, because that's that you're not hungry. You're eating because you out of habit, or you're eating because you have cravings. And the cravings are bad. Cravings are they're directly related to addiction.
Oh no.
They're like tied into your dopamine pathway, the reward system in your brain. And it's much easier to overcome hunger than it is to overcome cravings. So hunger can be overcome, like people fast for religious reasons and for health reasons, and they can easily distract themselves and ignore hunger.
I have met some people who want to lose weight and then started doing fasting and only drinks like black coffee from this period of time to that period of time, and then only eat once a day, and then doing it again, and they did see result, like huge result. But sometimes I'm like, is it healthy to only eat like once a day? And then sometimes we're so worried about overeating. But then in my head, I have never done fasting before, but in my head, I'm worried about maybe I'm not eating enough. So how do you measure that? Like overeating or not eating enough or eating the perfect amount?
Yeah. So everybody's different.
Yeah.
So you have to go by your weight.
Okay.
And your fat percentage, your muscle mass, your age, your activity level. Or if you have conditions, for example, diabetes or other health conditions. So for most people, I would say fasting is pretty safe.
Okay.
And it's a very effective way to lose weight. Our body can easily go 18, 20, 24 hours without food.
Oh.
We can, if we most of us have enough fat storage.
Yeah.
Maybe not you.
Yeah.
So if you are a little bit towards the lower side or underweight, then don't fast. Or if your blood sugars start to drop, and you can check, you can see if your sugars are dropping, then definitely don't fast.
Yeah, that's why I think it's so important to definitely go see a medical professional before you make those decisions, and do some lab work and see where you're at, and then see if it's good for you. Don't just follow a health trend, say, oh, this celebrity is doing fasting, then let me try that too.
Exactly. Yes. And also, just because somebody is overweight doesn't mean that they can safely fast. An outsider will look at them and say, oh, this person has enough fat, and they can fast. But the thing is, the person has fat, but for some reason is not able to access the fat. It's like having a door with a lock on it, on your fat adipose tissue. So if you can't access your fat cells, you cannot use them for energy. So, and we see that a lot in people who are overweight, but they don't have enough muscle mass. Their activity level is very low.
Yeah.
They don't exercise. So whenever they are trying to fast, they have nothing to use for energy because the fat cells don't open.
Okay, so
You
how do you open that door?
you open that door by lowering your insulin level,
Oh.
by raising your glucagon level,
Oh.
by gradually increasing your exercise, so your muscles can take up the glucose, and then once the glucose is channeled into your muscles, and is kind of your blood is cleared out of the sugar, then the fat cells and the insulin levels drop. That's when the fats will start to mobilize.
Okay, so you basically have to teach your body how to open that door to access the fat.
Exactly.
So you can start burning those fat and lose weight that way.
Yes.
Wow.
And that's another reason why sleep is so important.
Sleep?
Yes.
Okay, let's talk more about I like to sleep. Okay.
You like that's good for you.
Okay, yeah.
Good for you. So you have to have good night's sleep.
Okay.
Adequate sleep.
Mm-hmm.
Enough for your body to recharge. If you're not sleeping enough, or if you're not sleeping soundly or good amount, then your cortisol levels go up.
Okay, what does that mean?
Cortisol is a hormone.
Okay.
That is another culprit that will keep those doors locked.
Oh.
So no matter how hard you try to lose weight, you starve yourself, you're hungry, you're not putting any food in your mouth, you're still not losing weight.
You're not even accessing the fat, so
Because
you're not losing any weight.
Right.
You're not even touching it.
Exactly.
Oh.
So similar to insulin, except that the cortisol levels fluctuate, very fast.
Yeah.
Unfortunately, I mean, I have patients who have high cortisol levels even in their sleep. Like they're sleeping. Goodness sake.
Yeah.
Why is your cortisol so high?
Is it just genetic then, or?
It's stress.
Oh, stress.
Stress.
Okay.
You're not sleeping. You're snoring. You have sleep apnea, or you just had too much caffeine during the day. That although you feel that you're in bed, you're sleeping, but your brain is not going into the full sleep cycle. Yeah. You have to have the deep sleep, all the 3 stages of sleep, and then the rapid eye movement for your body to recharge. And if you're not doing it, your cortisol levels will be high at night, or even during the day, and it's so hard to lose weight.
Yeah, so I think people oftentimes just think losing weight is about eating, exercising. I never thought about sleeping. It can help to lose weight.
It's all of it. But you're right. Our diet and exercise is still the main ones.
Yeah.
And then sleep is important.
Yeah.
And then there are other things like social connections. Our friends, people we surround ourselves with.
Yeah.
So, do you know that you and I were sitting next to each other? When we do that regularly, we start sharing our microbiome.
What?
We start interacting. So next time, make sure your friends are healthy.
Wait, so how does that work? Like if we're sitting next to each other, and how does that whole thing work?
So especially, I would say more like it's about social eating, and when you're sharing your plate. Okay. Or when you're and also mentally you're you kind of start to do things that your friends do. You start to make choices, and consciously or unconsciously.
Yeah, now you mentioned that, I just remembered, like when I quit drinking, I noticed when I go out with my friends, normally we will all go out, we will all try to order a glass of wine. And I noticed when I go out with friends now, they will drink less. People I normally go and get dinner with, and I know their habit is, let's go get a glass of wine, just one glass, to go with dinner. And then now, because I don't know if it's because of me or what, they will stop doing that. They will just order the meal, and they feel like they can just drink water. They don't need to order that glass of wine, a cocktail or something. So I do notice
And you
a
didn't
behavior.
even
I didn't even tell them. I
you
didn't
didn't,
even
yeah,
ask them to do that.
you didn't even talk about it.
No,
Yeah,
I didn't even say, oh, hey, let's not drink
Mhm.
tonight. It's only my decision. I'm not gonna tell people, hey, I'm not drinking, so you can't drink. It's like whatever you feel comfortable with. And I guess they're just like thinking, oh, maybe I don't need drink.
Yeah, we all influence each other.
Yeah, so it's really important to also surround yourself with like-minded people or people who can help you, or
Yes,
have,
people who are trying to be proactive,
Yeah.
exercising. Like, have you noticed, like on social media, uh, like people post pictures of food?
Oh my gosh, every time if we go out and eat, we will like snap a picture of our food, post it on the story before we like eat the food.
Yeah. How many times like your friend or your family member will post a picture, and next thing you do is you're ordering the same food
or
for
like,
yourself.
oh, I have to go to that restaurant too now. It looks good. Oh my gosh. Yeah, you're right. It's like we're all influenced by social media or by our friends, or unintentionally like influenced by all of those things, unconsciousness. Yeah. I think that's that's interesting. I never thought about that. That's why I don't post food on my feed anymore. So I don't influence anybody.
Yeah, or maybe we can start posting
like healthy
foods,
food, like
broccoli, carrots.
Yeah, I think another thing I have a question about is BMI. Ever since I was in school, even my PE teacher will talk about BMI, and that kind of just like a term that we associate with our weight or our health. So can you explain to me what BMI stands for and how we calculate BMI?
So BMI is body mass index, and it's used everywhere. And I wish we didn't use it, but unfortunately we don't really have a choice. So BMI was actually invented by a mathematician,
not by a doctor.
Not by a doctor, in Belgium, and that was like almost 2 centuries ago. And ever since we just started using it, and we never changed it. So it's your weight, over your height. But what I really like to use is the body composition analysis, and that is what measures your muscle mass, your bone mass, your fat, and your water percentage. If we only go by the problem with the BMI is that it's basically it just tells you this is your weight, this is your height, and it will tell you if you are overweight, underweight, or normal weight. And if you just go by that, then we miss many people who look like they are normal weight or even underweight, but they are not metabolically healthy. They have internal fat, or they have fatty liver. Some people call them skinny fat, or toffee. Toffee is like thin on the outside and fat on the inside. Because for one reason or the other, their organs are not very healthy. Because there is fat on the outside, subcutaneous fat, and then there is fat that is around our organs, which is very important.
Yeah.
And then, with the same token, there are patients or people who are actually a little bit overweight, but they are fortunate. They are overweight, but they are metabolically healthy. So we have many people we see in our practice all the time. Their body mass index will be like 27. But when you do their labs, you check them inside out, they're perfectly fit and healthy because they have good amount of muscle mass, and their organs are healthy. They have good strong bones, and even though they have some fat, but it's all overall they're balanced very well.
So I guess when we talk about someone's weight, it's not just a number. We also, and it's not just fat. Like we need to take in consideration of the your bone density, your water weight, and your like the fat around your organs, and all of that. It's not just like, oh yeah, here's your number and you look, you are not healthy, you're fat. Like we also need to look at other things.
Exactly.
Because they're all factors, right?
And very, very, very much so.
Yeah.
I mean, I wish that each and every doctor's office would have that body composition scale.
Is it like a super expensive machine or
It's pricey.
It's pricey, yeah.
It's I mean, most of us it's hard for us to afford it.
Yeah, especially in primary care.
In primary care, we don't make much. But at the same time, it goes back to who's reimbursing for
Yeah.
these scales, and
true.
to do the analysis and then for the interpretation of the
Yeah.
analysis. Unfortunately, the insurance companies don't do much when it comes to reimbursement for these scales.
Yeah. If you're in Nashville, if you're like in the area, and I know the YMCA in Green Hills, they have one of those composition scale, and it's free to use for members.
Yes.
Yeah.
I think we should all, check it regularly, especially for women. We start to lose our bone mass and muscle mass, and almost all of us start to lose the muscle mass after, middle age in 40s and 50s. And muscle is it's the organ of longevity. The more muscle we have, even though muscle will add to your weight, it's extremely important for you to keep your muscle mass.
Yeah, so sometimes we probably shouldn't only focus on the number we see on the scale. We really need to dive deeper and have more data for ourselves just to understand our health. And it's going to be more targeted to start your health journey, like what kind of supplement will help you, so I think it's important. I think a lot of people don't really like to see like a primary care doctor even. I think it's because they don't want to know what's going on. If they don't check, they probably just say, oh, I'm healthy. But if you get like a lab work done, or if you do this type of analogy on somebody, it's like very clear, but it might deliver like bad news to people. But I just always tell people it's important to get to know yourself a little better.
Exactly. You're right. People don't ask. You just have to ask. And I mean, most doctors, especially in primary care, they love to talk about it because this is all about prevention. This is all about maintenance of health, and I mean, for me, that's my favorite topic.
Really? Yeah, I think it's this mindset we have that kind of affects us. Okay, so for my next question is, do you have any tips for people who are kind of struggle with their weight loss journey and probably don't want to start with medication yet and just want to kind of explore the other options, lifestyle change, and even you give patient advice on some lifestyle changes. So just give us some tips. Yeah.
So it's all about mindset. So it's like average human brain. We have about 60,000 to 70,000 thoughts that cross our mind every day. So in one day,
my brain is tired. No wonder why my brain is tired.
That's how our brain works. And 90% of those thoughts are repetitive. And guess what those thoughts, for most people, what those thoughts are? It's about food.
That's pretty accurate for me.
Which is a good. It's a
I'm
good
thinking
thing.
about food right now.
Yeah.
I'm thinking about food.
It's a good thing because we care. We like to know what we're gonna eat. Food is essential for our survival. Without food, we would not have any energy. But you have to kind of use your thought process in your favor. And I mean, food for many people is a source of joy, and which is great, it's wonderful. But if you start making healthy choices, then that food that you're eating is helping your body, your brain. That's good. But what happens is with the food industry revolution in the last century, our choices, unfortunately, are not always healthy. Our food, we have so much abundance of junk food, unhealthy food, that we kind of gotten used to it. We think that it's normal, it's healthy. Like sometimes we go for protein bars, shakes, things like that. And we don't differentiate between healthy and unhealthy food. So we need to educate ourselves what is healthy, what's not. So the number one toxin in food is sugar. So stop eating all sugar, first of all.
So is that, but it's okay to eat natural sugar, like from fruits or?
Yeah, natural sugar. Yeah, natural sugar is fine. So, and you're right, natural. So basically, try to pick foods that are whole foods, foods that grow on the trees or are on ground or underground, or foods that come from animal sources, and try to not eat anything that's processed or ultra processed. So the processed or ultra processed foods are the ones that are made in factories or anything that has ingredients in it that you cannot recreate in your own kitchen. That's processed.
Some ingredients I can't even pronounce. Like I don't even know what it is, but it's in there.
Yes.
Yeah.
Yeah. So when you're eating foods that have all those ingredients and the food is processed, it's sending your body a signal to just stay in the fat storage mode and not let the fat cells shrink.
What are some healthy snacks? If I just feel like I snack all the time, and that's my weakness.
Many healthy snacks.
Many?
Yeah. You have to look for them. You have to
I know fruits are fine, but I don't want to eat fruits all the time.
Yeah.
And then, because they're sweet. Yeah. And then, like
vegetables.
So
you can have carrots, cucumbers.
Okay, yeah, cucumbers.
Celery, any vegetable, good. Just eat it. So anything that grows on the trees, just go for it. Find it, eat it.
I'm gonna go find a tree now to get some healthy snacks.
Yeah, and you can have some nuts. Nuts are very healthy.
Okay.
The only problem with nuts is that people start eating too many of them. So nuts are good, eat them, but don't eat more than what can fit in your palm.
Okay, yeah.
For the whole day.
Whole day?
Yeah, and then you're done. If you're eating more than that, then that's they're very dense. They have high caloric density. So if you're trying to lose weight, then you should not eat more than that.
Okay.
If you're normal weight or if you're trying to gain weight, then then eat more nuts.
Okay. So I think I have seen some like very flavored, like highly seasoned nuts like in the store. Especially, I know I really like cashew, but they have one at Trader Joe's. It's like spicy lime flavor, and it's covered with like salt. And that's probably not good.
You're right. That's not good.
Yeah, it's a lot of sodium.
Yes.
But it's very tasty.
Sodium and even sugar.
Yeah.
Sugar is added into most of these processed foods.
For sure, yeah. So I think it's really like the food industry is trying to make delicious snacks so people will eat more.
They're tricking us.
They're tricking us.
They're tricking us. I mean, our taste buds we are hacked. The food industry, they're so smart.
They have scientists.
They're scientists.
They're scientists working.
They're working day and night, trying to trick our taste buds, trick our brains.
Yeah.
And if we don't fight back, what happens?
Yeah.
We see that every day.
Yeah.
We gain weight.
Yeah. I think the whole thing about like weight management for me, like learning from you, is like be really mindful about the decisions and you make working out or doing some exercise or the snacks you want to eat or the food you want to eat, how much you want to eat. And it's all like you have to think about it before you make those decisions. And sometimes I notice myself like watching a TV show while I'm eating dinner. And I don't notice, but like later I finish the whole thing and I feel like super bloated because I was distracted. So I'm not really mindful of, I'm not hungry anymore. Maybe I should stop.
Yes. Being mindful. And, there is a lag of this. It is It's a lag of 3 to 7 milliseconds
Oh.
between your thought and that the thought that comes to your mind, and then the time that you actually understand it or act on it. So many people, they tell themselves, oh yeah, I'm not going to eat bad, I'm not going to eat bad.
Mhm.
But when they're presented with a bag of chips, the next thing you know is they finished the whole
Eating
bag.
Yeah.
Because they give up the control over their thoughts. So you have to remember that if you're not being proactive, your desire to eat the junk food will take over. So you have to be continuously on, watching yourself. Yeah, it's like, it may sound harsh, but for food cravings, it's important. And once you kind of start training your thought process and start, making that a habit, and also start telling people around you that you're trying to be healthy and make healthy choices, then it gets easier.
Yeah, I think it just takes time. It won't change overnight. It takes months or even years to not just lose weight, like to have a healthy lifestyle and be consistent with it.
Exactly.
Yeah.
Mhm.
So what about your own health journey? Like, have you ever struggled with weight or?
I try to stay healthy, and
Yeah.
for me, like my BMI is normal. I've never been overweight in my life.
Yeah.
But with my first pregnancy, I gained maybe 35 pounds, and the whole pregnancy, which is is normal.
Yeah.
But I developed gestational diabetes.
Oh.
So when like people who have TOFI, or they're skinny fat, so having a normal weight doesn't always mean that you're healthy inside. Your pancreas may not be very efficient. For some people, just gaining a little bit of weight, their BMI may still be in the normal range, but they start developing insulin resistance or even diabetes. So it's very important that you talk to your doctor, get yourself checked.
We talked about healthy eating habits and be mindful about what you eat, how much you eat. But what about exercising? How much should people exercise, or how often should we exercise? And
mainly exercises for your mental health. So when you exercise, you feel good, you get endorphins, you feel motivated. Exercise helps you gain muscle. When you have more muscle mass, it's easier for you to do intermittent fasting, to go longer periods of time without food, so you can eat less and then lose weight. But exercise by itself, like if you run for a whole hour or 10K,
no, never again.
never again.
No.
That will only help you burn maybe 400 calories.
Really?
Yeah, it's not much, but the main role the exercise has is its effect on your mental health.
Yeah.
So, but if you don't, so now ask me, if can you just lose weight by dieting and not exercising at all? No, it will be extremely hard for you to lose weight if you're not exercising, because as we lose weight, we start losing our muscle mass, and then we hit a plateau because our body doesn't like it. We want to keep muscle mass, so it becomes extremely hard to lose weight if you don't have good amount of muscle, because muscle is a main source of glycogen outside of the liver. If you don't have enough muscle and you're fasting or eating less, then there's no resource inside your body. So exercise will keep you feel good mentally, emotionally, and also will help you gain some muscle. So I would say exercise is maybe 10% helpful in weight loss, and diet is about 90%.
Wow.
But both are essential.
Yeah.
You cannot lose weight just by exercising, or you cannot lose weight just by dieting. You have to do both.
You have to do both. And if you think about it, it totally makes sense, because we are humans, like we kind of need to exercise and we need to eat healthy. So it totally makes sense to do both. It's not just focusing on one. And I think a lot of times I feel like we just need to do things or in moderation. Like don't overdo things or don't over exercise.
Right.
I mean, for me, is I basically destroyed my knees running a 10K without training. That's not recommended at all.
Do gradually. You're right.
Do gradually
in a safe way. And the best exercise is NEAT.
Mm-hmm.
NEAT is a non-exercise activity thermogenesis.
Mm-hmm.
Basically, that means that you stay active all day without actually exercising.
Oh.
So you walk up the stairs instead of taking elevator. You park your car at a distance, so you are walking to the building. You carry your own bags, your groceries. So exercise like people do in blue zones, where you're growing your own your vegetables. You have a garden, things like that.
Yeah.
But unfortunately, that's not possible for most of us. So
because we sit at a desk all day and
we
work,
have a desk job, or even if we have a standing job,
standing desk.
Standing desk, we cannot always do NEAT.
Mm-hmm.
So we can. You can exercise, but start slow. Don't rush yourself into doing marathons. Start with like 10 minutes. 10 to 20. Even if you do, like studies have proven, people who do even 4 minutes of exercise, high intensity interval training, they have better outcomes than people who don't exercise at all. So start slow and you'll start feeling good, and then start doing more and more.
Yeah, I think that's a good advice, especially I think it's hard to fit a workout class to someone's busy schedule. So if we do just small exercise throughout the day, it's better than nothing. Because I think some people, or even myself, I will get super overwhelmed thinking, oh my gosh, I worked all day, and then now I have to go to the gym after work for an hour to get my daily exercise in. And I kind of just mentally get a little overwhelmed thinking I can't just go straight home and rest because I already kind of maxed out at work and I don't want to do anything after work. But then I know exercise is good for me, but just kind of feel like I'm forcing myself to do more. But yeah, that's a good advice if we just break it down to small workouts throughout the day.
Yeah,
it will definitely help.
Yeah, or do it in the morning, first thing in the morning. So for some people, that's the best time to do it because you can kind of push yourself. Sometimes you just have to push yourself. So in the morning, when you're still in bed, you just want to lay in bed, tell your brain, okay, I'm going to count backwards from 10. And then by the time you're down to 1, you will be out of bed. And there is something about it that when you start doing it, it just kind of wakes you up and you get out of bed and tell yourself, if on days when you don't feel like exercising, just tell yourself, okay, I'll only go for 10 minutes. And after just the first 3 or 4 minutes, you'll start liking it. And then you want to do more.
Yeah. Thank you for tuning into this episode of Mad Nation. We covered a range of topics, including the most common types of weight loss programs and how they work, who will be a good candidate for these programs, and the role of nutrition in weight management, including some healthy eating habits that can help with weight loss. It was an insightful and informative discussion, and we hope that you found it helpful in your own health journey. Thank you again for listening, and we look forward to bringing you more informative and engaging content in the future.